And then now it's muted. Okay, great. When I'm not sitting there, I'm a person. I am. Yeah, I'm gonna grab a seat right there. Thank you so much.
Everyone, say, por favor.
Okay.
La biografía de Regina al todo sobre el acceso a la atención médica para nuestra comunidad aquí de Condado de Santa Bárbara. Realmente es un honor ser parte de este panel y gracias a todos nuestros panelistas que hoy están aquí y qué manera de entender a nuestra comunidad latina que estando con la comunidad, como yo digo, vayan al trabajo del campo, vayan al campo, eso es lo más importante para conocer en realidad a nuestra comunidad latina. Recuerden que servir y ayudar es una meta valiosa que tiene un impacto positivo en la vida de las personas. Sé que son tiempos difíciles, pero lo que les digo es que no perdamos esa identidad. ese idioma. Siéntanse orgullosos de hablar su idioma, de portar sus raíces, su cultura, de hablar español y extenso. Nunca dejen que nadie les diga que son menos, ¿verdad? Estamos aquí juntos en comunidad y por primera vez en muchos años que yo llevo haciendo un trabajo voluntario, nunca habíamos podido conseguir estos grandes panelistas con una gran información. Así que darles el aplauso. Y para mí es un honor presentar a Sandy Close, que viene desde San Francisco con el medio de comunicación más importante de todos Estados Unidos, American Community Media. Ella es una eminencia, es una persona que por 35 años ha hecho esta clase de eventos, ha alzado la voz por la minoría, como nosotros, que nos ven pequeños, pero somos grandes en espíritu y en corazón. Así que para mí es un honor tener aquí a Sandy Close, que es una eminencia.
I apologize if I don't speak Spanish. And I'm so glad to have our interpreters here with Spanish and Mixteco. We hope that if you have questions, you will raise your hand after our speaker finishes. And we will come and ask you your question and make sure that our panel can respond. This is a wonderful event that is organized by the Department of Health Care Services, which runs Medicaid. And they want to be on the ground with community. Well, this is what inspires us as journalists to want to work with them. And the people who come from the county are similar. They want to be here to answer your questions. So with that, at a time of fear, uncertainty, misinformation, to address some of your concerns about access to healthcare. And we begin with our first speaker, who represents the Department of Health Care Services. I'm going to let her introduce herself. She is going to give you an overview of what is happening around Medicaid. So with that, I introduce you to Ying-Jung Wong, who came here from Sacramento to be with us tonight. Ying-Jung, thank you.
Thank you, Philippi. How's everyone doing tonight? Good. I'm very excited to see all of you. My name is Ginja. Can you hear me okay? Fantastic. So my name is Ginja. I work for the Department of Healthcare Services up in Sacramento, which Department of Healthcare Services, you probably may not know who it is, what the organization is. It's the state agency. We administer the program, the Medicaid program. Many of you probably know it's the program where you go and get health insurance, and it's a white card with a poppy flower, and you know, it's a very important program. We cover, the Medicaid program covers 1 of every 3 Californians. And so we know it's so important to be here. And so a really big thank you to the community for having us here tonight. As Sandy was sharing, I'm here from Sacramento, so I had a very eventful day. I actually flew down to Burbank, drove up here. You're probably like, oh, you probably make it coming faster if you just drove down from Sacramento. Well, good, that's how you learn, next time I know. So I'm very happy to be in Santa Maria today, and big thank you to all of you. We really want to have this opportunity to have a direct conversation with the community here. Healthcare services, you know, and the program administrators of Medicaid. There's a lot of changes going on. You're in the news, whether it be the local news, but I wanted here just to tell you that the Medicaid program, even though there are changes coming up, I want you to know Medicaid is not going away. We're here to continue to provide healthcare to all of you. And remember, healthcare under Medicaid still covers preventative care, dental, vision, medications of the pharmacy. And also sometimes even now, we just released a new benefit called transitional rent. Where under our managed care plans, my partners here will later share a little bit more about that, where it will help you with a rental assistance in terms of the dollars you need to actually pay rent and move the there. And just wanting you to know that the program itself, even though there's so many changes under the federal administration right now, the program is still here to support you. Remember, Medicaid, it has an annual renewal process. Many of you might remember every year you get a packet from the Medicaid program. This probably comes from Santa Barbara County, since you're in Santa Maria. Or if you are the neighboring county, maybe San Luis Obispo County, it comes in a double envelope. And it tells you must renew this coverage every year. We want you to make sure that you're still doing that. That is so important to keep your Medicaid. In 2026, there's some changes that I wanted to highlight for you. Again, the program itself isn't going away. There are some changes. So beginning early this year, January 1st of 26, Medicaid froze enrollment for a subset of individuals. And it's individuals without documentation status. However, if you were already in the program prior to January 1st of 2026, which is this year, you're still what we call grandfathered into the program. You will still have the full breadth of the Medicaid services that are offered to you. If you apply after January 1st of this year, if you're pregnant, if you're a former foster child, if you're a child under the age of 19, you will still get the full breadth of Medicaid services. When I talk about the full breadth, what that means, it means you'll still get the preventative care, you can still see your family doctor, your vision, prescription, mental health, substance disorders, and all the type of kind of preventative care that you can also get under kind of the normal circumstances. Also, this year, there also is another change that's very specific to our individuals that are age 65 and older, and maybe disabled. Medicaid is bringing back what we call access. In the Medicaid program, you definitely know this, hopefully, that you can have one house, one car, that's okay. We don't count that as part of the Medicaid determination. You can own that, no concern. However, beginning January 1st of this year, when I say assets, you can have up to $130,000 in assets, and that asset is bank account, and things that you own that's more than that one house, so maybe a rental home, for example. Just want to say California has a very high, kind of 130,000 in asset threshold. But we are bringing that back, and we will be reviewing those documentation as part of your annual redetermination, which is blended every year. And lastly, also wanting to share that there is a subgroup of Medicaid population where beginning July 1st of 2027, there will be a $30 premium. Remember, your Medicaid isn't going away, it's only going to be for a subgroup of all the Medicaid population. And that is next year. So I just want you to know that that's coming. But we will have the noticing and, just to make sure we're informing you of those changes. Department of Healthcare Services know, like, in order for us to make sure that we're spreading the word, we're doing these types of events to make sure we're connecting with you on the ground. Letting you know and sharing that these changes are coming. It will be impactful, but the program itself isn't going away. But there will be some changes that you need to know about and to make decisions. Also, we're gonna start texting individuals, so if you have, your phone number, when we're applying for Medi-Cal, we have started texting individuals in the community about these changes. You may have actually received a text message from the Department of Healthcare Services about these changes. So really wanting to reassure you though, continue to make sure you're returning your yellow packet in the mail that is coming to you. And also lastly, don't be afraid to apply. We want to make sure that you get the care that you deserve. So please continue on applying and making sure that, the paperwork is in place, the renewal packets, the yellow packets you guys are receiving in the mail, and coming back to the county, reviewing the text messages that we sent you. We're here to help you, and my colleagues here will share some additional information, that we're not going away. So I really want to make sure folks here, there's only one thing you take away besides the burritos and, the new friends that you're making at your table. Just know the program is not going away. The program is here to stay, but there are changes, and we're committed to making sure you understand what those are this year and next year. Thank you.
I would love for the model reporters and our community attendees to raise your hand. We have time for 2 or 3 questions. We will take more questions at the end of the panel. But who has a question now? If you could raise your hand. Yes. Who has a question?
What happens to people who come here pregnant, feel just arrived from the country pregnant, and they access healthcare?
So pregnant individuals are exempt from any of these changes in Medi-Cal, and if you need care and you're pregnant, there's a couple of options. We have hospital presumptive eligibility if that's needed. We have a program for just for pregnant women, meaning that it's a short application, and you'll get immediate care. And then they will also have to, once they get immediate care for all prenatal, pregnancy-related services, they can also apply for the long-term Medicare with Medi-Cal, which is a full application. So all to say is pregnant individuals who come to this country have immediate access to healthcare. And that's not going on.
You know, that's.
Doesn't matter if they have faith. What's their status? What's their status?
So if you apply for presumptive eligibility for pregnant women, which is a Medi-Cal, a version of the Medi-Cal program, it's regardless of your immigration status. It's very important you, and this is the name of the program, it's called presumptive eligibility for pregnant individuals. And very short application, you fill it out at the doctor's office, and immediately they'll get the prenatal, any pregnancy related care that necessary to support the pregnancy.
You know, we could set up working with different families, they told me that they are not afraid that they give me a place to contact the if you experience quite a situation in each person and also, told me that it's very hard to apply for Medicare or to renew the program. Even it's hard for the people that can speak Spanish, that with for our pasado well, but especially for those that speak for example, Facebook. So if the program is not to make the process easier, thank you.
My apologies, I wasn't able to get the first half of your, question. I caught the second about supporting, further supporting, different languages. So we are actually investing, and this is pending the legislature's approval for additional navigators on the ground to support, families. And because, we know language barriers is a real issue. And so the idea is that the department, with some healthcare philanthropy, will be partnering, to actually, implement what we call clinic navigators program, where they actually will have navigators who can speak, the languages in the community. And they will be kind of physically present and meeting the member or individual where they are at the point of care to help them fill out the application, fill out the renewal paperwork, etc. So we are definitely thinking about that, understanding that we may have some limitations right now. But right now we do have a $4 million kind of budget request in this year and in the approval of the legislature so that we could actually start this program. So I think in general, I think the question is, what will we share from the department's perspective about people who are afraid to apply? As I shared before in my earlier remarks, I think it's, don't be afraid. We are still telling folks in the community, spreading the word that people need to and should continue applying. Because it really is, healthcare is your right, and you need to have that access to care, and this is why we are community for. And, we are kind of thinking about different pathways to encourage that, and, there's ideas in the community, to kind of provide that reassurance. We can absolutely do that. This is why Department of Healthcare Services is here to actually provide that working reassurance to you. Please do not be afraid. Please continue.
Okay, thank you so much. One more question. This is for you, Dr. Medina. One question for the community we've heard is medical benefits, person including working. Will there be working requirements in order to receive medical?
A great question. So the question is about whether the work requirement, which you guys probably have heard the news, will be applicable to the population. So, so maybe a little background about what that is. So this policy is a federal policy that became law in July of last year, where beginning January 1st of 2027, if your age is 19, if you're between the age of 19 through 64, you're maybe under 138% of the federal poverty level. They're like, what the heck is 138%? Have that. So if you're a single person and you're making $1,836 a month, you're making below that, and you are not providing care for a child that is 13 and under, they have to actually subject, meaning that growth requirements may apply to. And what does that mean is every month you will have to prove you're either making $580 a month, that's counted by the federal minimum wage, or you're out there performing 80 hours of community service, or you're a half-time student / full-time student, depending on what you are. Or there's a bunch of other exemptions. If you're pregnant, doesn't apply to you. If you're a former foster care child, doesn't apply to you. If you're a child under the age of 19, does not apply to you. Right now, where we are, we're still working through, the policy guidance. It is a federal policy that California, and unfortunately, all states, have to follow because it's federal law. It will be effective January 1st of the 2027. So what I can say is, we will do what we need to do in California to make sure that we are reducing the amount of people that actually need to, that are subject, to this policy. So there's a bunch of data sources out there where we can use your information to verify whether you are already exempt or you are already compliant. So we are gonna maximize everything we can as government, use all the sources and information available to us, so that you people not have to actually fill out additional paperwork or actually go and actually meet these sort of requirements. So prior to that, though, we will make sure we will limit that to all of the notices, text messaging, make sure you know what the requirements are. But really wanting to stress that it should not be a barrier to do, to be afraid to apply for Medicaid. Medicaid is no weird, but I just shared, those are the key of our requirement. And so we wanted to stress, whatever we do, at the state level, that the roll this out in the next, 10 months, you will be notified. Notice will come into the language that you prefer, and so that you will actually have adequate notice and we will make it.
Thank you, good job. We can go back to the questions. We just have to go to our next speaker, but if we have one more question, okay, please. Okay, thank you. So, and one of the translate the boxes we want to, ¿cuánto es el costo para ganar, para poder fabricar medicamentos? Porque yo lo acabo de hacer, lo acabo de quitar. Tengo una estudiante que tiene 10 años, depende de mí, también se la acabo de quitar. Entonces yo quiero saber cuánto es el costo para poder aplicar medicamentos.
She wants to know how much you need in order to qualify for the Medicare. So we have the benefits, there, I think that has the right to Medicare too. So we want to know what.
So what I'm going to do, it depends on your health. So what I'm going to do, I'm going to give you my card, and let's connect. So there is some circumstances that are different for every family, so.
So please, maybe you go from the panel and just respond. Because what we so value questions from the community. Thank you. Our next speaker is now speaking from Santa Cal, the health care plan that covers Santa Maria and the whole of Santa Barbara. And we welcome and are appreciative of Jordan for every time this evening. Jordan, let's see your mind. Maybe you want to use this.
I think I might want to. There we go. Thank you, Sandy. Good evening. It's so nice to be here with all of you tonight. I want to start by introducing myself and my colleagues. Sandy said, my name is Jordan Recipients. I'm the Chief People Engagement Officer at Medicaid Health. I'm joined by my colleague. Señor Rodríguez, la asociada, la directora asociada de servicios para miembros con organizaciones del trabajo. And I'm also joined by several colleagues at the table in the front, Dr. Vonda Reynoso, our Chief Customer Experience Officer, Sarah McDonald, who's one of our board members, Lisa Bravo, the Chief Executive Officer at Family Service Agency of Santa Barbara County. FSA has a booth in the back, and Central Health has a booth in the back. So please feel free to connect with any of my colleagues, either here at this table or in the back. Okay. Okay, I'm just gonna start talking about work. Okay, perfect. So we heard from my colleague at the Department of Healthcare Services that in California, the National Medicaid program is known as Medicaid. If you qualify for and have an account in Santa Barbara or San Luis Obispo County, then health is your health insurance plan. We don't determine your eligibility, we don't enroll you, but we provide access to services through the Med-Cal program. Our mission is to improve the health and well-being of the communities we serve by providing access to high-quality health services, along with education and outreach for our members. And we're guided every day by our values, which are integrity, compassionate service, collaboration, and improvement. We've been serving Santa Barbara County for 43 years. We're actually the oldest health plan of our time in the country, and it's an honor to be here and to be doing this work with all of you. Right now, we serve around 238,000 residents of both of our counties. Approximately 172,000 live in Santa Barbara. For context, that's 1 in 3 residents of Santa Barbara County and 1 in 4 residents of San Luis Obispo County. The Medicaid program provides a variety of benefits to those who are enrolled, and to discuss those benefits, I'm going to hand the mic to Elliot.
Muy buenas noches. Es un placer estar aquí con todos ustedes. Como deseaba decir, mi nombre es Delia Rodríguez, soy la directora asociada del Departamento de Servicios para Miembros del Medicaid. He estado con la organización por 21 años. Los servicios para los miembros del Medicaid son cuidado primario, cuidado especializado, servicios sensitivos, servicios a ayuda hospital, servicios de emergencia. Tenemos atención de salud mental, servicios de transporte, visitas de doctor y de regreso a casa. Tenemos servicios de laboratorio, medicamentos a través del programa Medicaid Part X y servicios de traducción comunitaria de actividad. Algunos de estos servicios también que tenemos disponibles a nuestros miembros son depósitos de vivienda para esas personas que están en peligro de perder su hogar o en lugar de estar sin hogar. Hay ciertos criterios que tienen que calificar para esos servicios, pero estamos aquí disponibles para poder contestar esas preguntas. También tenemos consultas por telesalud disponibles a nuestros miembros y una línea de consejos de enfermera de centro que está abierta las 24 horas, los 7 días de la semana. Si no tienen que ir al hospital o a la sala de emergencia, pueden llamar en esta línea y hay una enfermera que va a contestar y que ayuda a consultar sus preguntas que tengan sobre qué está pasando. Otros servicios para miembros de la por nuestro departamento de servicios para miembros, el cual puede ayudar con cualquier pregunta que tengan. Nuestras horas son de lunes a viernes, de 8 de la mañana a 5 de la tarde, y se puede llamar al mismo en los partidos que tenemos para que también hay servicios de organización de California llamando o marcando el 7 o 10. ¿Qué otros servicios otras opciones tienen los asociados de Medicaid? ¿Cómo les podemos ayudar? Y es posible encontrar con doctor, con el especialista, y quiero preguntar sobre los beneficios. ¿Qué les ha sacado? ¿Cómo les podemos ayudar? Si alguien con nosotros está mandando un cobro, o nosotros podemos ayudar, ponemos problemas de la población. También pueden cometer una queja de esa satisfacción o si quieren apelar una decisión que se les ha negado. Por eso les va a hacer cosas para ayudarles. Nosotros hacemos todo el papeleo con facilitar. Ustedes no lo tienen que hacer. Estamos aquí para ayudar. Servicios de transportación, servicios de UTFD. También si necesitan la tenencia de un especialista. Hay desinfector de individuos. Ustedes tienen que ir cierto especialista. Nosotros podemos ayudarles con esa referencia. Cualquier pregunta que ustedes tengan. En nuestra mesa que tenemos Medicaid, trajimos una información sobre preguntas y respuestas disponibles, las tenemos en español y entonces para todos ustedes. Esto concluye nuestra presentación de hoy día. Pues como dije, por favor, estar aquí con todos ustedes. Muchas gracias.
I thought I would take 2 or 3 questions. And honestly, I felt really good more. You know, how that question. But I also welcome the community. I the questions are about the healthcare plan that probably serves most of us in Israel.
I have a question. Sorry. This microphone's really loud. Okay, so my name is Brenda Garcia. I'm a provider, so I appreciate somehow I have a provider under you for mental health services. And so Jordan, thank you so much for your information, and that's exactly the reason I'm here. So I can't identify my clients, but half of them are undocumented. And I do know that last year, some of us failed the Zoom meeting, and some of the people here went to Santa Barbara County district meeting, where we talked to our board of supervisors because public health wanted to transfer 7,000 patients last year. Right? So because we filled Santa Barbara County district supervisors, and they, you know, they made a decision to not transfer these 7,000 cases immediately. And then there were other agenda items. However, with what you're saying, and they wanted to jump the gun, right? Public health wanted to jump the gun, because they knew the big beautiful bill was coming and all this stuff. Which is fine, right? And that's for educating us, especially myself as a provider. I'm here to get educated, because what do I tell clients? Right? These are better. So I, because Claudia, you know, very good at like getting us together to find out answers and be able to provide those services. So that is how clients were, okay, like now something's gonna happen July 1st, 2027. But from here to July 1st, 2027, what do we tell them?
That's very important information. What is your criteria? You are going to address.
Set out. Is there a transition plan? Is there no transition plan? Is there, hey, we can transfer X amount of cases that you currently have? Or hey, there's gonna be this program we offer. Well, that's still, you know, access to cancer care, for example. I can't even imagine what's gonna happen to cancer care patient.
Also, in the past, was very follow up on the record because you are a provider and you have these very important questions.
So thank you very much for the question. I know that our county partners are here. I'm certainly not my staff. What I will share is that our health members, you have access to a primary care provider sign you. You have access to special support services, to mental health services. If your provider changes, we will make sure that you have a new provider. Take care. So I hope that answers your question. If you have a specific question for my county colleague, I know that they're on the panel, and I'm sure we can have it. Any comment, thank you.
And after the, if you have questions, you should come up and ask Jordan, oh yeah. So you get a chance to follow along. Okay. Any other questions for Jordan? Next week, continue.
Hola. Yes, Mr. Martini from HispanicLA.com. And I was talking to people from the community-based organization, and they told me something that really surprised me. That during the pandemic, apparently a lot of workers felt the kind of encouraged to use technology. And they actually match it. So I don't think they're coming here, but they would bill 3, and then bill 3. That's it. For rural. Because what they were telling me is that they do communicate with some of their clients through computers and smartphones. So are you familiar with the SB 388? And do you know the status of that law? Now it's actually a law. And I think that they were looking for like, how many million actually promote the initiative.
And if you're not, you can follow up with Nestor, because this is a chance for us to find out what we don't know. And we often don't know what we don't know. So it's very important.
I cannot speak to the status of that bill. I can say that our members have access to information through our member portal. My colleague in the Department of Health Care Services also spoke to text messaging that's about to be rolled out, and so hopefully that addresses some of your questions or have them follow that.
Great, and we have time for one more question. Roxy from the community, yes. Technology and offline doesn't work with it. That's what we do. Bueno. Roxy, why don't you get her question and repeat it?
Yo estoy hablando por todos mis compañeros del campo, yo trabajo en la prensa y hay muchas personas que no tienen medical ni integral. ¿Por qué se necesita para poder tener medical y quiénes son las personas que califican?
Don't have medical or dental, if you want to know, what they need to qualify for those, testing.
Very good question. I'm gonna ask you, an answer and also ask, Elliot to answer.
So in order for you to qualify, it's actually an application you could do online, benefitsal.com. You could go online and apply, or you could call the county, that's also an option. You could also go to the lobby and do a walk-in application. So there's a couple of modalities for you to go and get to apply and get to coverage. once you become eligible, if the county has, 45 days to make a determination, then oftentimes it's faster now with a lot of the new, changes that have happened. And once you are eligible, what happens is then, Central will, or there will be like a choice packet that you sent to you to choose the plan. So you won't even need to choose, it will be sent out, in terms of them providing the information to you. But the first step is filling out the Medi-Cal application. And you could do that online on the phone, or also if you would like to do a walk-in to the. Walk into the county social services office. You have two more questions from the community.
Someone wants to know if those people that from Central are included one from, then holders.
Very good.
So beginning on July 1st of 2026, there are certain Medi-Cal populations that will no longer receive dental service. And it's specific to, certain populations with certain immigration statuses. So your STEM count won't be impacted, because, if you're in, Santa Barbara County, you will have what we call, Medi-Cal dental fee for service. So it's separate and apart, your STEM count won't be impacted. But again, if you have a certain populations with certain immigration statuses, beginning on July 1st of 2026, dental coverage no longer is covered under Medi-Cal. However, if you are pregnant or if you're a child that's 19 and under, that will not impact. Or if you're a former foster youth, or a foster care child, you will not be impacted. You will continue to keep your dental coverage.
Last question before I.
According to that, the resident children, the posting, for homeless people in order to pay. So the posting, pay.
Could you repeat the question? Because I think so, this part of this room here.
So, la pregunta, quiero, la pregunta que hicieron es sobre los fondos para prestar sus rentas. Como les mencioné, hay ciertos criterios, por las personas, los miembros del Central House, si es protección o beneficio disponible. Pero como les dije, sí hay ciertos criterios que se tienen que cumplir. Si tienen más preguntas, pueden llamar. Nosotros podemos ver qué se puede hacer para poderlos ayudar con eso.
La pregunta es justamente para las personas hombres que están en este momento en situación de legal.
También esos servicios están disponibles para esas personas que tenemos ciertos equipos del health que están constantemente trabajando con personas que no tienen un hogar para poderles ayudar a encontrar un hogar. Sí tenemos servicios disponibles para ayudar con ellos.
¿Qué tan rápido es ayuda precisamente, ayuda para la renta? ¿Qué criterios? Porque habló de criterios de relación muy especiales.
Tenemos equipos con centros que se especializan en eso, con los criterios que ellos tienen, como les digo, ellos pueden ayudar llamando a nuestro número gratuito, nuestro personal habla español también, se les puede explicar esa información con más detalle. Podemos conectarnos directamente con ellos para que puedan ayudar.
Okay, we want to go to our last speakers, so that we have plenty of time at 6:30 for people to come and ask individual questions. Right, there's, as we have radio and Lugina here, I want to make sure, when you have any questions before we move on.
Thank you. Here, of course, another questions from the community besides, in regards to medical, but about, food services, like how fresh people that are also depend on medical and also depend on coverage. What are the new updates, for coverage?
Thank you. That is a perfect segue to, I think I'll go to Dario next. And then Dario Radonsky is with the Department of Social Service. And thank you so much for being here tonight, Dario.
Thank you for having me. So, what is the question exactly?
Correct. Really about, correct?
Yeah.
What's happening? Those kind of services.
Yeah, so we still have health first. Community, that is not going away. Actually, we have a table over here, health fresh information, and how to apply health fresh. Some of the major changes that are coming out in the program. Effective April 2026, those who are non-citizen qualify for health fresh. That's going to change. So, there's a new definition of non-citizens who can qualify for health fresh benefit. And then effective June 2026, we're also going to have a word requirement in the health fresh program. So there are changes also coming up in CalFresh, when it comes to, who is a non-citizen can qualify for CalFresh. And also, work requirements that will be implemented in 2026. And the way that we, one of our goals and objectives is to make sure that the community is informed and they're aware of these changes so they can make an informed decision. So one of the things that I do recommend is that everybody follows the website. That's what we post our changes. We also have social media accounts where we share information. And you can also sign up with benefitscloud.com to receive text message out there. So these are changes coming up in CalFresh. There still needs to be guidance from the state. We're still drafting policies for our staff. And the best way to stay up to date with these changes is to follow the website, follow the social media, and to sign up for residency.
Thank you. And please, share with us before I sort of started doing your question. What is your sense of the most important services in the department overseas and who qualifies and what changes? I mean, I think what people want to know is what's happening now, and just as you said, what could have happened in the future.
So just in general, when it comes to social services,
I'm sorry, the programs that the department has installed.
yeah, so social services, we offer a diverse and wide range of services. We offer Medicare, which we just heard about. We also offer CalFresh, which is food assistance. We also have CalWorks, which is a cash aid for families. Within CalWorks, we have Wilbert Work, which is employment training and education for those who participate in the CalWorks program. We also have homeless assistance for those families. We also have a general relief program, which is cash assistance, usually for individuals who are single and don't have a child at home. We have a lot of services and programs that we offer today. That's the question I'm going to answer.
And yes, what are you most concerned about with the in terms of the people who come tonight that they need to know they can access now? Maybe as of June, no longer, but the focus is now. What are the most important services people need to know they can access now?
Yeah, so I think at the HCS may actually going with this, we're still here. Our programs are going changes, even though we still have a lot of guidance and detection and extending, so we may not have all the answers. I guess the message was if you need assistance, if you need help, please contact the family. You can contact us via phone, you can walk into your offices, you can walk into and we are here to inform if you are we try to access that.
Thank you. I'm going to ask Michaela Hillard, West Hall now, to follow from county health. Because this is really where the services, I'm going to give you my microphone, okay?
Thank you. First of all, I'm delighted to be here this evening and it's a real honor to be invited and to be. Sorry about that. And I would also like to take the opportunity to introduce County Health, formerly known as Santa Barbara County Public Health Department. And with this evening, we have Paula Lizano, Division Chief of the Medicare Public Health, joined by Ryan Schumacher, Chief Information Officer, and Dr. Cristiano, who's our Chief Medical Officer. And our representation at the table is also with the Minister of Medicare, and Alvin, who's been so helpful to set this up. And all available afterwards to also help and support. I just want to let you know that this event is very near and dear to my heart. I've lived here now for 21 years. I moved here when my son was a week old. And I've been with the health department for 17 years, mainly in Longport. I'm the homestead administrator now, both for Longport and Santa Maria. And for the county health department, what I think a lot of folks might not be aware of, that we actually have 5 health centers in Santa Barbara County. There's mainly in the South County and Santa Barbara, Franklin, and Carpinteria. And at North County, we have Lompoc and Santa Maria. And we provide you with your own doctor who knows you and your family. And that is so important. And the preventative care, especially right now, that's what's really the priority for all of us. We don't want you should not want to wait until you're sick or you have to go to the hospital. We want to take care of you now for prevention. I think that's I don't know how to say it in Spanish, but it's, I think, a famous thing all over the world. An ounce of prevention is better than an amount of cure. And I think that's, so true nowadays. And that's, we take care of your short-term illness, long-term disease, and give advice to help you stay healthy. We also help coordinate your care across multiple settings. And also really want to thank our partners to help us navigate the system and our patients. So it's a true partnership. We provide, everything really. It's family practice, pediatric care, immunization, urgent care, same-day visits, behavioral health, medication-assisted treatment, and substance use. And also between, I'm really proud to say, between Longport and Santa Maria, we offer a full range of women's health services, including OA services. And just like earlier, there are really no significant changes. It's all about the prevention. So also, especially afterwards, please see us at our table. Give us your information, go reach out to you or call our health centers, and we'll be glad to give you more information and schedule your appointment. In addition to our family practice, we also offer ancillary services. So we have registered dietitians, lactation consultants,
home visits with babies and mothers, MCH department. And we also have care home service navigators that help you navigate the system, because we all know it's very complex, but there is help for you. And so we also, everybody, we're not an island. I think we all rely on each other, and we think, health department, we really pride ourselves to be connected to so many services. One of the things that we started, thanks to our director, Lorana and Omani, we actually have enjoyed a great partnership with the Santa Barbara County Food Bank. And so we have monthly distributions both in Santa Maria and then local in Santa Maria. It's on the second Tuesday, I always get confused. Santa Maria is the second Wednesday of every month from 2 to 4 p.m. So we just had our distribution yesterday afternoon, and it's right in front of the health center, right where social services, probation, the government offices are. Anybody can come, so please, take advantage of it. And while you're in the food bank, stop at the health center and find out how we can help you, all the services that we provide. Even Lomo, that's on the third Tuesday of every month from 2 to 4 p.m. So really want to invite everybody to, take advantage, of the services. As far as the coverage goes, I think we already done a lot of information from our partners, but I think the key for our department is knowing what we turn away. You do not need to have Medicaid any coverage. If you are a healthy patient, we offer a sliding scale, we really work with you. But whether it's health services, we also work with the state program of the family path, as well as everyone in house, and there's my understanding they also that they send to money. Again, there's so much information. I think it's almost sometimes overwhelming, but please don't hesitate to check in with us, and we'll have you navigate. It's all in Spanish here, so we covered that. And then I hope that most of you of the with our donation. But the Santa Maria address is the 2115 South Center Point Parkway, and it's really the government building where you have our social services, probation, DSS. I think everybody knows what that is. And Longboat also we share the campus with social services, providing the community on North R Street, and I really hope to see you there. Thank you so much.
And we're going to ask a question of Claudia. We have a question here. Great. Okay. Can you stand up?
I want to reiterate this question because I don't believe there's specifically what we get projected from that. What would get to qualify for being accepted for Medicaid? That's why the question is to apply because that's so. What is the thinking that rejects from Medicaid? So, a couple things where you may, deny for medical coverage. The reason usually is because of income. You exceed the income threshold. So say you are a family size of 4. Every year there is what we call an update to the federal poverty level, which is a dollar amount. Every year it changes slightly, and it's tied to like inflation and things like that. So depending on how you file your taxes, who lives in your household, the income level may change. The dollar amount is usually what will disqualify you. This is oftentimes what we do see. In California, regardless of your immigration status, even though there has been some changes, Even though if, say, you are an individual without documentation status, but you meet the income threshold for mental, you still get emergency services, you still get pregnancy-related services through the 365 days, that 1 year postpartum period, you get, kind of the full breadth of benefit. So usually, if you are under the age of, 65, it's usually your income. I talked a little bit in my presentation about assets. So if you are 65 and older, and you do have assets, if you have a second home potentially, like second home, a second car, depending on the money you have in your bank account, if it exceeds $130,000, then you may potentially qualify for income. And one last thing that may disqualify you is if you don't return your paperwork. That is also the most important thing. If you get something from the county asking you to provide additional information, make sure you return it. Or if you're moving, make sure you're updating your address with the county, or else if we can't find you, there is a possibility we will have to disenroll you or basically move you off the program because we can't actually get the information back because we're sending it to the wrong address. So those are usually the reasons that we see where the state.
Question.
Y también me aparece ahora en la
No, it wasn't at the state level, it's just one for this is the current compromise. There are federal rules where if you are off the Medicaid program, which is federal based program that has for your years, you have to share some information with the family. Now, what I can say is part of the state here, the program is still basic, your real if you could do it, you could go about. Now, that is really important. The program is not going away. So my federal perspective, that we think that is the second, so that is going to which is our federal control agency. To the fact that whether there is a personal basis of that is, and then there's an ongoing law at the federal level that's not. So what I can say is at the state level, we are very committed at the Department of Health and Human Services, especially the privacy. And that's why I'm here today, because I know there is that real indicator of this, but our jails are still open and we want to set their legislation. But you know, also that there's a vision, but really, there's to share with you that the program isn't going away, so those services are still available in the stations for the company.
qualified for first full graduation. Then, you'll probably have a
para mantener la lengua a los hijos para que no se olviden, no se olviden de pecar. Es el propósito que iniciamos con este proyecto. Lo que es la barrera y el desafío que enfrentamos como comunidad cristiana. Vamos a hacer este momento, porque la barrera que enfrentamos estaba escuchando a los presentadores de África y los ven para entrar y agarrar información, para poder terminar la aplicación de verdad para la ciudad de muchas personas no saben no terminan en el van a poder entrar a agarrar esa información. Entonces, desde la barrera que se va a agarrar la información. Por eso estamos hablando de los cambios que van a venir. Todos los pasos que vienen por nuestra lengua. No estamos hablando de una sola comunidad. Estamos hablando de después de terminar sobre Oaxaca y tener no sé qué guardar cómo puede llegar esa información. A veces información en inglés y luego se hace en español y luego se va a traducir el texto verbalmente. La información que va a quedar correcta puede faltar o puede agregar. Right, got it.
Updates or changes in the programs, including health. Yeah, including healthcare and other changes that might be taking place in the community, and also the inability to read or write sometimes that also makes it different.
I, I ask Francisco, what do you think the biggest concern is with Ishtec residents around healthcare access? What are you seeing, especially parents with children? Are they taking the children for health checkups, or are they worried about getting stopped?
¿Puedes repetir otra vez? Como los cambios que se están hablando es, a lo mejor por sus ingresos tienen miedo de perder el beneficio. Porque como digo, no hay otro forma de llegar esa información en su lengua. Como esta noche tenemos mucha información, ¿cómo podemos llegar a tener esa información futuro para que ellos también tengan preocupación de, porque como estaba diciendo, también tengo una historia de unas familias que tenía que no pasar de 1,800 para poder calificar, pero esa persona gana $4,000 al mes y paga $3,000 de renta y le queda $1,000 para pagar sus comidas, su gasolina y los otros biles que entonces no le queda nada de dinero. Entonces, y así todavía no calificó. Entonces, eso sería la preocupación y el miedo de las familias.
Thank you. Dario.
So, what I read is that the main concern is losing benefits. Losing benefits, and also that we're not reaching the community in a way that is working for them necessarily. And then he gave the example of a family who didn't qualify for assistance, even though they were barely able to meet their needs, but they were still denied.
And things like this help people feel more confident.
Sí, gracias a ustedes como American Community Medias, y gracias al tiempo digital y a sus servidores, ¿no? Esa información no es para nosotros, es para nuestra comunidad, que ellos se puedan empoderar de esta información para poder ayudarse en sí mismo. Y esos, yo pienso que los agencias locales deberían de hacer esto para poder informar más nuestra gente, porque en su horario de trabajos, pues, imagínate que a las 7 de la mañana sale a las 4 de la tarde. La gente tiene que ir a buscar, pero cuando no saben cómo llegar ahí, ¿cómo van a llegar? Entonces yo creo que tenemos que buscar un lugar también para que nuestra gente se acerque. Como el día de hoy, pues, tenemos siempre para esta información.
Could you summarize? Thank you. Yes, so he said, yes, this is helpful and thank you. And he said that it's good that we're going to the community and having these events because most of them work from 7 a.m. to 4 p.m. And they're not available during office or business hours. So it's good that we are coming out and being here with them. Thank you. I ask our panel to address what Francisco said about the information gap. And it's partly a language gap and a gap of time, but how this is a challenge and why we have so many journalists here tonight. We want to help you. We want to thank the community members who came because you are the best informers of your neighbors in your community. I'd like to ask each of our speakers for a final comment on how we bridge this information gap when there's so much uncertainty. A lot of people don't have computers, don't have access to the internet even, and they're dependent on word of mouth or radio programs like Radio Indigena and Spanish language media. I think he has another. So it's starting with you. To do
Tengo otras preocupaciones también, como trabajamos como padres de familias, pero son trabajadores y trabajadoras agrícolas. Hay mujeres embarazadas que no lo deshabilitan solo, a los 8 meses, y esas mujeres embarazadas están en puestos de los químicos que usan. Esperen del campo. Quieren enfermar que sus hijos también no se pueden aceptar, que en las escuelas, como esta, hay muchos niños que tienen autismo, que tienen déficit de atención. No es genética el problema, yo creo que es algo de los químicos, de los trabajadores y trabajadoras, está expuesto en el químico del campo. Gracias.
Hey, please. I should have had an interpreter just for Joseph. I'll take the extra credit for this. I'm good. Okay. So here, I think the concern that he mentioned is that there are some farm workers who are expecting, they're pregnant, and they're working all the way to month number 8. And that's just a concern that they shouldn't be waiting that long to be able to go on leave and have access to disability benefits. Now, Radio Indigena, Jorge. To find the state.
Okay, thank you, Coach. Two things. Regards to maternity leave, Understanding that in the agricultural field, they can go on maternity leave once they have a positive pregnancy test. Once they have a positive pregnancy test, they can go right away on maternity leave. This is what I've heard recently. So let's corroborate that, if that is true. Women working in the agricultural field, they can go on maternity leave as soon as they have a positive pregnancy test. And
Unfortunately, that's actually the department, the agency that oversees that component.
This is coming from the labor department where I heard this. I don't have the exact permission, but this is something that I recently hear, and this it's sad hearing that hearing that are working, 8 months pregnancy, This is very important to share with the community that they act like if this is true what I'm saying, that women can go maternity leave right away, if they're working in the agricultural field. And this is awesome that we're doing this because we can learn more about all these resources and information. The second thing that I wanted to mention is about the information gap, the language barrier that Cisco was sharing that our community, a lot of our community don't know how to read, and for example, I need to be shared with them is in the native language. We something that I wanted to share with Francisco is, for example, my cup. Last year we lost like 80% of our funding because medical navigators program. Okay, we also suffer budget cuts. Francisco, if he knows about makeup, it's Ana Maria. Office is Ana Maria. He can direct the community to our office there. Let me get the address in case he doesn't know, or if people don't know. The address in Santa Maria is 110 South Lincoln Maria Street. Sorry, 110 South Lincoln Street in Santa Maria. And the zip code is 93458 201. And if the community that have a question, they can go to our office and there will be someone that will speak Mixteco to them and can help them with the information. We have the Navigators program in Santa Maria. And again, it's our resources. So, Michael, we have worked with Sanko and projects, it's an opportunity to work together Navigators program for the community and bridge that gap.
I think it's come to the end of our program. Should you get a last word about and do as better and for being here tonight and knowing that these are great sources. So let's start in just a minute because we're late. And we want to give people a chance to go to the tables, get the baskets. Yes,
Short. So again, just emphasizing, the state cannot obviously be every. Unfortunately, we cannot make all the information accessible in every single document. And so we have department to share today, spread the word in your now still changes are coming to understand what they are. And to we talked about the accessibility starting journey
shooting if the legislature approves the. So please. Still, make sure you return our packets, the red packets that are coming to you, making sure the count. Addresses, we want to make sure you keep the out. Thank you. Trotsky, the Cal medical plan.
Thank you,
Let's
Sandy.
get a plan.
Is this on? There we go. Perfect. This has been such rich conversation and what I want to say is that if you have a question, call Cal Health. We might not be able to answer it. We might need to refer you to social services or to DHCS, but we are a no wrong door. We partner with MyCop to offer interpreter services so we can talk to you in your language. We can connect you with community organizations like Family Service Agency who can help you with enrollment paperwork, with application paperwork. So please, if you have any questions, feel free to start with us. Our phone number and our resources are on the table in the back of the room. We're here to support you.
Thank you. Elliot, did you have a last word or?
Yo nomás quería también, en adición de lo que dijo la señorita Jordan, es que también si un miembro que habla mixteco, dependiendo el idioma que hablen, pueden llamar a Cal Health. Nosotros tenemos también una agencia de intérpretes telefónica para las personas que hablan mixteco y porque son diferentes variantes, sí nos toca un poquito de información tenemos que obtener porque tenemos que saber de qué están para el intérprete para ellos, pero tenemos intérpretes telefónicos también disponibles para que se puedan nosotros. Todos los representantes que contestan las líneas, son un total de 15 representantes, 13 de ellos son bilingües, hablan español, pero
Okay, thank you. And Michaela Killer Westall of County Health.
Thank you so much, Sandy and thank you, everybody. Just wanna, just echo what, thank you, what Francisco Lozano's concern, but also advice was. I think we at County Health, together with our partners, also with Cal, we've been working hard on providing STECO interpretation services. And so I'm very proud to say that currently at the Santa Maria Health Center, we have 2 interpreters from the STECO, have STECO patients, also in and we're here to serve the community. And if you don't have coverage, please come to our doors. We have children's presumptive eligibility time. You don't need to provide any documentation because we really don't want you to prevent your children from getting their physicals, their immunizations. That is a time. So please do have a table. Just give us your contact information. Just call us and we can give you all the information for the services. So don't feel like you need to have coverage in order to get your health care. So everybody, especially the ministers and other interpreters.
That's a very important message.
Yeah.
And Dario Prodazzi, thank you also for your services for me today.
No, thank you. There were some comments about benefits being denied. I just wanted to mention that when benefits are denied, you have a right to request an appeal. So you can appeal a denial of benefits. So when you get the notice of action, on the back of the notice will say how to request an appeal. So if you're not in agreement with the denial, you can appeal the denial. And also if your case discontinues because you failed to complete have a grace period to be able to complete it without having to reapply. So we always encourage that you try to restate your benefits instead of reapplying for aid. Also, the county has a farm resource center. So we have a center, the county social services that works with the farm worker community. So we invite you to visit and become familiar with those resources. Should be to receive social services benefits. So you should stop to the office and bring about the services. That should not be available. It's available for outreach. So if you just to visit with your organization, your community, please reach out and be excited and happy to go out and do this kind of thing.
Francisco, final.
Buenas noches. Hola. El trabajo que estoy haciendo por mi comunidad, y otras organizaciones, es mi corazón. Estoy haciendo un trabajo de hacer, estar aquí, haciendo el trabajo. Ver al éxito de esta noche. Se hizo grande esta junta de la noche. Estoy aquí trabajando dentro de las bibliotecas. Usted no sabe lo que es se hacen estudios se cae cuando saben que están enfermos, pero se hacen chicos así como sí, sí lo están haciendo todavía, sigamos haciendo y ayudar dar educación la comunidad. Son una gran universidad, estamos en Santa María. Muchísimas gracias. A lo mejor. Y a los demás, para la otra junta, lo voy a invitar para que vengan, porque eso es importante. Muchísimas gracias.
Thank you. Final summary.
Yeah, so he said that for coming and joining us.
Yeah.
He talked about some of the challenges just in the community where it's like to have a primary care physician or an annual physical, so we should continue with these events.
Thank you. I want to ask Claudia for a final word and thank the table, the resource people who came, the people who came with sheets of food. But I want to, Claudia, mainly thank you for convening such a great gathering. Could you say final words of what people say?
Gracias de verdad por estar aquí. Ustedes hacen gran esta comunidad. Juntos somos más fuertes. Unidos somos un mismo. En verdad, decir lo que sienten, sus inquietudes. El mensaje que dio Francisco es real y poderoso. Y cada uno lo sabe, ¿verdad? Las verdades que atraviesa la comunidad, principalmente aquí en Santa María. Nosotros nos debemos a nuestra comunidad. Es el único lugar que vamos a dejar. Y quizás algo que nosotros hagamos puede inspirar, con que inspire a una persona. Este foro, gracias a Sandy y a Peter, que surgió nada más de que vieron en tu tiempo digital que estábamos recolectando despensas. Ven cómo algo tan pequeño y tan insignificante se volvió tan grande. Y sobre todo la información. Es la primera vez que yo subí la 15 años y nunca tan hermoso. Entonces, en verdad hay que agradecer a ellos, que son nuestros representantes. Ya les dieron ustedes sus preguntas, sus dudas, si tienen más, por favor. Sí. Es importante que ellos se lleven toda la información, haciendo sus notas, y me gusta eso, porque al fin del día esto se debe de llevar a las personas indicadas para hacer cambios. Nosotros estamos también para ustedes, necesitamos de ustedes, necesitamos de las agencias de gobierno, necesitamos de los líderes, necesitamos de Francisco. Francisco lleva 12 años haciendo un trabajo increíble, tiene un gran poder. Así como se llena aquí, él llena cada mes el comité mixto, es increíble. Usemos a Francisco, usemos a cada líder en verdad como agencias. Las agencias deben de ver más en español. Escasez. Desafortunadamente, el tiempo digital somos el único medio que brinda ese servicio. Más medios deberían de brindar. Estoy tan orgullosa de tener tantos medios de otros, de todo el estado, de San Francisco, Los Ángeles, de Riverside, de Oxnard. Para mí es un honor y nunca imaginé hace 20 años estar parada aquí en español, ser parte de este cambio importante para la comunidad. Es un cambio para mí, para tu tiempo digital, para Francisco. Es un cambio para ustedes mismos, para nuestra que nos vemos, desde las 3 de la mañana. Trabajar al campo, nos fuimos a tomar fotos y testimonios. Es un trabajo. Muchos de ustedes se han ido al campo, los que están en el necesitan una hora. El campo no está lejos, está en su casa seguramente. Des esa oportunidad. Si yo lo que soy es compartir eso, y eso es lo único que nos vamos a llevar a estar bien. Así que muchas gracias. Ya vamos a tener las donaciones, queremos que se lleven todo lo que, gracias a Dios y toda la comunidad, hacen allá, también hay comida, se van a llevar, y del lado izquierdo también está el comedor de Santa Bárbara, que tiene kits, bolsas dentales y todo, y por favor, váyanse con mucha alegría de que juntos en comunidad somos más fuertes, y por favor no pierdan esa identidad es lo que los hace únicos.